Send. Good morning, everyone, and thank you for coming. My name is State Representative Paul Schemel. I'm joined by a number of other state representatives here in the Pennsylvania House. We're here to talk about gender dysphoria and particularly the health care that's administered to children with gender dysphoria. Now, gender dysphoria is a discomfort with one's own biological sex. 4 years ago, the Health Committee, under the direction of Representative Chairman Kathy Rapp, performed a survey and a number of hearings on gender dysphoria in youth, and particularly the treatment that children were receiving in Pennsylvania facilities. As part of those hearings, we heard from expert testifiers, physicians who work in the gender facilities themselves that were referred to us by Dr. Rachel Levine, who is now the U.S. Surgeon General, and also physicians who work in the realm of gender dysphoria who oppose a number of the different administrative and medical treatments that are being utilized in a number of our facilities. We also, from that, produced a written report. There are copies of that available on the side, if you would like it tonight, that reveal a number of the things that we found. Right now, there are a number of facilities in the state of Pennsylvania that perform medical interventions on children facing gender dysphoria. There are 3 in particular at the time that we did the study. One was the Children's Hospital of Philadelphia, one the Children's Hospital of Pittsburgh, and the other was the Hershey Medical Center. We heard from testifiers from Children's Hospital of Philadelphia and Hershey Medical Center on what was happening at those facilities. They testified that they had treated thousands of children in their individual facilities with what is commonly called the Dutch protocol. The Dutch protocol has 4 different stages for children that are facing gender dysphoria. The first stage is just acceptance of that child in the gender that they prefer. So if they're a biological boy and they identify as a girl, then that acceptance is allowing them to use their own pronouns, a different name, change in clothing, things like that. The second stage in the Dutch protocol is the administration of puberty-blocking drugs to prevent the child from going through natural puberty. The third stage is cross-sex hormones, that is injecting the hormones of the opposite sex into the child to give them some of the physical characteristics of the opposite sex. And the fourth stage is surgical intervention. Surgical intervention would be the removal of healthy breast tissue from girls and changing the genitalia for both boys and girls. In the case of surgical interventions, all of our testifiers reported that very few surgical interventions were being administered for youth, but the Children's Hospital of Philadelphia had reported that they had referred a number of girls for breast removal at age 17, but some as young as age 14. Now, from the analysis that we've done since then, we know that some hospitals in Pennsylvania, particularly UPMC, which you'll hear Minority Leader Cutler talk about, has implemented a policy with regard to surgical interventions, and we understand that Hershey Medical Center has as well, where they do not do surgical interventions on minors. However, there will be data that you will see that in the past, some of these institutions have. We have a few different speakers today. The first speaker will be Representative Brian Cutler, who is the Minority Leader in the House.
Thank you, Representative Schemel. I want to thank everybody for being here this morning. I want to thank Chairwoman Rapp and Representative Schemel, who was the subcommittee chair, and the members that were serving in that capacity, as well as the Pennsylvania Family Institute for their work on this issue several years ago and bringing it to light. The harm that is done to children from an industry that taxpayers support to engage in services related to sex reassignment and transition-related services and drugs is not only life-altering, but I think in many respects we all would agree, and certainly in my opinion, is irreparable. The numbers and information that you will hear from those that follow me speak for themselves. But let me provide a little context for you and the state, the bottom line here, and why we're here today. Pennsylvania taxpayer dollars were and possibly still are being used to engage in sex reassignment surgery and transgender medicine for Pennsylvania's children. When children are very young, this reassignment and transgender medicine, it can be, in my opinion, viewed as the health system has certainly let them down. Because we know, and the challenge is, that the human brain is not fully developed until age 25. Children, especially younger children, can make impulsive decisions and conduct themselves in a way that reflects their current level of maturity. If you ask a child at 6 what they want to be when they grow up, you're likely to get a different answer at 16, and then yet another answer at 22. So I would offer that it is actually impossible for a young child to fully understand and consent to life-altering treatment and this kind of intervention. And I want to recognize Penn State Hershey Children's Hospital and UPMC for already having strict policies that have been put in place when it comes to patients under the age of 18. That is common sense and shows the type of compassion required to tell a child no to such a serious decision at that young age. It's unconscionable for state taxpayer dollars to be spent on this type of physical and mental harm, which could and has befallen many children who later regret their transition decisions. Let me be clear. It is our position that no state tax dollars should be used for this type of medical practice. Again, I want to thank Representative Schemel and the members of the subcommittee and the Pennsylvania Family Institute for their work in this area. And I hope that every Pennsylvania taxpayer of conscience will speak up with us and against their use of their money in this way. Thank you, Representative Schemel.
Thank you. The impetus behind this event today is the revelation of data from Do No Harm from a couple of weeks ago, indicating that hospitals and hospital systems within Pennsylvania and really across the country have been coding insurance claims for these kinds of surgical interventions and also other interventions on youth for gender-affirming care, or what is termed gender-affirming care. So next I would like to invite Beth Serio from Do No Harm to tell us some about their findings.
Good morning. Thank you, Representative Schemel, and thank you, Representative Cutler. Thank you to all of you for being here today. My name is Beth Serio. I'm the External Relations Manager with Do No Harm. We're here to discuss our new initiative, Stop the Harm, Exposing the Child Trans Industry in America. This is a first-of-its-kind database which was recently launched to catalog child sex change treatments performed in hospitals across the country. Now, parents and policymakers and concerned citizens can simply look up their local hospital and see what kind of gender medical interventions are happening to children in their community. Nationwide, we identified almost 14,000 children subjected to sex change interventions from 2019 to 2023, and over $120 million in insurance claims for these treatments. In Pennsylvania alone, we identified over 800 child sex change patients. Over 300 of these children were subjected to sex change surgeries. These can include mastectomies or top surgeries, but also more gruesome procedures such as phalloplasties that irreversibly damage the child's genitals. The child trans industry can also be a very lucrative business. Pennsylvania hospitals submitted over $6 million in claims for these interventions during our target period. It's important to note that these figures are just the tip of the iceberg of what's really happening in children's hospitals across the state and across the country. And these dollar figures are likely an undercount of how much hospitals are raking in from the suffering of children. Our data does not include private payments, claims through the VA, and claims through the Kaiser Permanente system. So the numbers are likely far higher, and our database is providing a baseline to show which hospitals are performing these procedures. But even at this baseline, the results are just simply mind-boggling. And beyond quantifying the scope of the problem and creating this resource, we also want to expose the people and the institutions who are most responsible for promoting and performing these procedures and prescribing these treatments on America's children. This is how we can exert pressure on the decision makers and prompt tangible, lasting policy changes. In addition to constructing our database, we also profiled the 12 worst offending children's hospitals in the nation. These are our dirty dozen hospitals. And what we found is that many of the most prolific prescribers of cross-sex hormones and performers of child sex change surgeries are also the most vocal proponents of gender ideology. For instance, one of our dirty dozen is the Children's Hospital of Philadelphia, or CHOP, located right here in Pennsylvania. And you can see some of our data on this poster here. CHOP's gender clinic is run by Dr. Nadia Daushin, a gender ideologue who has advocated against legislation intended to rein in these harmful procedures and protect Pennsylvania children. In 2017, Daushin messaged the now Assistant Secretary of Health, Dr. Rachel Levine, acknowledging that she, Daushin, was not aware of any literature to support child sex change surgeries on children, but that they were being performed anyway. And CHOP is not the only Pennsylvania offender. At the UPMC Children's Hospital of Pittsburgh, children, according to their website, children as young as 9 years old can seek so-called gender-affirming care at the hospital in the form of hormonal interventions, so cross-sex hormones or puberty blockers, through the hospital's gender and sexual development program. These practices are going on at children's hospitals and affiliated hospitals in communities across the state. We think that people have a right to know what goes on at their child's medical provider. It's important that the public has the tools to understand and appreciate just how pervasive these practices are and which hospitals are performing these dangerous and unsupported medical procedures on children. This is how communities can begin to hold these hospitals accountable. Thank you.
Thank you, Beth. In addition to the work done by Do No Harm, the Pennsylvania Family Institute has been seeking information from the Commonwealth of Pennsylvania through right to know requests. Now we'll hear from Dan Barkowiak regarding this information.
Well, first and foremost, it is sobering to hear, those statistics, the database. You can find it at stoptheharmdatabase.com. And these are our children's lives, the thousands of children that are being highlighted here. And so it's just sobering to hear, Beth at Do No Harm highlight that. And it highlights the reality that we're in, that this is one of the worst medical scandals in history, not only for Pennsylvania, but across the nation and frankly across the world, what we're seeing. So I want to take a moment, I want to recognize three groups of leaders when it comes to exposing what is happening in this industry. And first is certainly Do No Harm. What they've done with this database has given us tools to be able to understand what is happening in these hospitals, what is happening in our neighborhoods. So I thank Beth, I thank her team for the rigorous research that was done to highlight what is happening with this reality of what we're doing to children. It's chilling to hear that this is just the tip of the iceberg. All this rigor that they did, and really what they're finding is that it's just the tip of the iceberg. So there's more research and investigating needed when it comes to this issue. Certainly, a second group I want to highlight are certainly the elected officials standing behind me and many others here in Pennsylvania that are looking to take leadership on this. I thank Representative Rapp, Kathy Rapp, for her leadership several years ago, having hearings through the Health Committee, trying to understand what is happening in Pennsylvania. We had groups like Children's Hospital of Philadelphia come and testify. It was at that hearing that we heard that when it came to age limits on surgery, they were lobbying to eliminate any lower age limit. They admittedly want to do this at age 14 when it comes to irreversible surgeries. We're talking children, the consent that they're supposedly able to give, and we're talking as young as age 14, giving these types of surgeries. It's that needs to be more exposed. We need to find out more what is happening at these hospitals, what is happening here in Pennsylvania. And so I appreciate Leader Cutler and many standing behind me that are looking to do more of exposing what is happening in Pennsylvania. And then certainly I want to highlight those that we are harming through what is called, the state calls sex reassignment and transition-related services and drugs, what that's doing to children. One in particular is Chloe Cole. She has been vocal in highlighting what happened to her. At age 13, she was started on the track of puberty blockers, and at just the age of 15, had a double mastectomy. She now regrets that. It's her own words. We had an interview with Pennsylvania Family Institute just recently with her, and hearing her talk about how this destroyed her. It destroyed her health. It destroyed my body, and no child can consent to this. She's absolutely right, and sadly, there are thousands of children like her. What this database has exposed is that, sadly, Chloe is not alone, and it's something that we need to continue to investigate and find out what is truly happening. Pennsylvania Family Institute, we've done a variety of right-to-know requests. We continue to try to find more information from the state. One thing that is for sure is since 2015, with the nominating of Dr. Levine as Physician General, what that did, the advocacy behind this industry, the money that was given to this industry, saw more and more children harmed. We see every year the rise in number of children, and we're talking ages as young as 5, 6 years old, that are being put on a track of sex reassignment and transition-related services and drugs. It's a title that the state gives. It was a handful of kids in 2015. We're now talking thousands of kids right now that are being harmed by this industry. So I thank everyone for being here. I thank you for, again, Do No Harm. The website stoptheharmdatabase.com. You can look up this information. We also have the interview of Chloe Cole and others at our website, pafamily.org, for Pennsylvania Family Institute. So again, thank you for this. Please continue to follow this issue, and we need to have more exposure of what's truly happening in Pennsylvania.
Thank you, Dan. Next, we'll hear from Senator Judy Ward, Chair of the Aging and Children and Youth Committee in the Pennsylvania State Senate.
Thank you so much, and thank you to PA Family Institute and Do No Harm for inviting me to be here with you all today to speak on the creation of Stop the Harm database. This database, launched by Do No Harm, is the first of its kind national database of hospitals and medical facilities administering irreversible sex change interventions on children in the United States. And it chronicles a horrific trend that our children are under attack. From 2019 to 2023, nearly 14,000 children received permanent gender reassignment-related treatments. More than 5,500 sex change surgeries were performed on children, and almost 63,000 hormone and puberty blocker prescriptions were written for 8,500 minors. Most disturbingly of all, these barbaric procedures and practices will make the medical industry almost $120 million while leaving our children mutilated. And these choices have consequences. Children taking sex-changing hormones may have an increased risk of depression, cardiovascular disease, and decreased bone density. Those who undergo surgical procedures often experience sexual dysfunction for the rest of their lives and may lose the ability to conceive children. How does a child possibly make an informed decision on life-altering choices such as these? They can't, and they need adults to protect them. They need those who care about them and those in positions of authority to stand up for them and their future at a time in their life when they cannot. Let's face it, we don't allow minors to buy cigarettes or alcohol for a reason. How much longer do we wait before we step up and do something? How many more children will be butchered and allowed to make a decision that they may regret the rest of their life? I will continue to work with the advocacy groups like Pennsylvania Family Institute and Do No Harm, and my colleagues in the Senate and the House to do all we can do to ensure the safety and future of our children. Thank you very much.
Thank you, Judy. At the beginning, we talked about the 4 steps in the Dutch protocol. We're often told that the first 3, that is, just allowing a person to go by different pronouns or a different name, using puberty-blocking drugs, and the administration of cross-sex hormones are fully reversible. But the analysis that our subcommittee had from expert testimony, individuals that have used, for example, puberty-blocking drugs to treat precocious puberty, is that these are not irreversible interventions. In fact, they have permanent, lifetime effects on the individuals for which they are administered. So these are not reversible. And then in the testimony that we received from individuals from the gender clinics, they said of all the people that they've treated, of the thousands of children that they've collectively treated, none have desisted. Desisted is becoming comfortable in their natural biological sex. The testimony we also received that under the standard diagnostic and statistical manual, which is the manual that psychiatrists and psychologists use, that 90% or more of children will desist if they're simply allowed to act as the children they are, to go through puberty and the natural sex that they are. They become comfortable in the bodies of who they are. Instead, with these interventions, you take the 90% away and you have a 0%. All of these children become damaged for life. Now let's be clear. What we're talking about today is children. Adults will do what adults choose to do. Adults have the mental maturity to make decisions, but children do not. Children do not. They require adults to make decisions for them. That's why the information that we're providing today, the information that Do No Harm has done about what hospitals and hospital systems are doing in our own Commonwealth is so important. It sheds a light on what's happening to the children of our Commonwealth. We thank you very much for attending today, and the members of the panel who spoke will all be available after the press conference for any questions that you may have. Thank you.